Imagine you are a college student studying abroad in Spain. This is your first time to Europe, so you travel to various countries every weekend, hoping to get as much out of this experience as possible. You are enjoying sights such as the Eiffel Tower in France and Buckingham Palace in England. Next, you plan to visit Italy, but then the news breaks out. The coronavirus that began in China has now migrated to Italy, and Italy has a travel ban going into the country. Then, not surprisingly, the coronavirus cases in Spain accelerate, and it's imperative to get back to the United States quickly. After arrival in the States, the next thing you know, you are infected with the coronavirus and dealing with its effects. This story is true, and it happened to my sister. Fortunately, she is now recovered from the virus, but its impact on our world is affecting everyone whether they have the virus or not. For example, as of this morning, the World Health Organization reported approximately 33,000 deaths and 700,000 confirmed cases worldwide. Considering how relevant this virus is right now, it is important to take precautionary measures so we can stay safe from the coronavirus pandemic. Therefore, I will explain to you what the coronavirus is and its symptoms, how the virus has affected travel, and finally, how to protect yourself. So how do you identify if you or someone you know has the coronavirus? The coronavirus belongs to a family that causes mild to severe respiratory illnesses, such as the common cold. Typically, these viruses cause disease in animals, however, some have made their way to humans. For example, SARS, short for Severe Acute Respiratory Syndrome, emerged in late 2002 in Asia. According to the National Institute of Allergy and Infectious Diseases, this coronavirus spread to almost all continents, though it was contained and disappeared in 2004 after affecting over 8,000 people. Similarly, the most recent coronavirus, known as COVID-19, originated in December of 2019 in Wuhan, China, and is still spreading throughout the world at a rapid pace. If a person has contracted the virus, symptoms can show 2 to 14 days after exposure, which can be through person-to-person contact or even by touching an infected surface. The most common symptoms would include a fever, a cough, and/or shortness of breath. However, according to a health article from CNN.com, other symptoms can be flu or cold-like, which includes headaches, fatigue, runny nose, and more. After hearing how quickly the virus has spread, there of course have been major effects of travel. While it may seem obvious, traveling during this time can cause more spread of the virus. Specifically in the United States, travel is not encouraged at the moment. It even feels like since many restaurants, bars, and other stores are closed, you cannot even travel in your hometown except for necessities. Our recent global health advisory from travel.state.gov states that many countries are experiencing COVID-19 outbreaks and implementing travel restrictions and mandatory quarantines, closing borders, and prohibiting non-citizens from entry with little advance notice. Airlines have also been canceling international flights, and many cruise operators have suspended or canceled trips. In addition, there is also the European travel ban. BBC News reported on March 14th about the ban, saying President Donald Trump's travel ban on 26 European nations has come into force in the US as part of a contingency plan to tackle the coronavirus crisis. At the time, my sister was still in Spain, so when my parents heard this, they quickly bought her tickets back home the next day before the ban went into place. And of course, she self-quarantined for the next 14 days. Aside from all the warnings not to travel right now, if you do decide to travel, it is important to be extra safe. For example, if a person is sick, it is recommended that they wear a face mask. And if you are not sick, try to avoid touching highly used surfaces such as elevator buttons or door handles, and use a tissue or sleeve to touch something. Finally, this leads into preventing COVID-19 in general. First, since COVID-19 is relatively new, there is no vaccine yet. Therefore, treatment for this disease focuses on the symptoms only. There are several simple ways to stay healthy from the coronavirus. First, washing your hands frequently for at least 20 seconds, and also avoiding touching your eyes, mouth, or nose. In addition, there are also steps you can take to protect others. The new term, social distancing, is important to prevent others from getting sick. And practicing distancing yourself from others will benefit everyone and stop the spread of the coronavirus. This is especially important to those who are more likely to get the virus, as the CDC warns the public that older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing serious complications from the COVID-19 illness. Overall, stay home if you are sick and cover your mouth if you cough or sneeze. We are all unsure as to how long places and schools will remain closed, travel will be banned, and events will be canceled, but it is important to do your part and take this virus seriously. However, now that you know what the symptoms are, how it has affected travel, and how to stay safe, it should be easier to make smart decisions. And now that my sister is home from being abroad and recovered from the coronavirus, hopefully we can start hanging out together again, even if it is 6 feet apart.